The things that we're going to be talking about over the next few hours are genuinely life-saving for people if we can get it right. And what we want to do right at the beginning of this process is to think how we can build in patient voice, how can we build in the engagement of people like yourselves into it all. We want to create something exciting and different, something which engages people, something that you might think, as people in your various organisations and interests and patients might think, is their body, something that actually is working tirelessly on their behalf. So you can genuinely say at the end of this process that you feel that you're part of what we're trying to do here, which is to build a fantastic healthcare system for the people of this country. That's, I think, the challenge for us. How can we really think forward about how we can construct something that really can improve the services and the outcomes for patients? What's really important for the Commissioning Board is to be in close connection with what patients want and what they need. And there are a variety of ways in which we can do that. We can get analysis, information, all that sort of thing, but we want to hear directly from patients as well. We think in doing that, bringing the patient voice into the boardroom of the Commissioning Board, we get a much better chance of providing really top-drawer service for patients and giving patients and communities the outcomes that they need.
What's encouraged me today is that everybody is here. We all want best possible outcomes for the patient. When we're all working together, you know, we've all got the patient's interest at heart, and that's what it's all about.
What I'd like to see is a slight different culture where patient and public input goes in the early stage of planning, of thinking about things, of development, as well as looking at what the outcomes are.
It's important that the Commissioning Board in particular ensures that there is proper scrutiny and accountability and transparency in ensuring that services genuinely meet real needs and that people are genuinely involved in decisions about their care, and how we're going to make sure that conditions like arthritis are not inadvertently neglected from a scenario of who shouts the loudest.
Specialised commissioners are generally very good at involving their patients, and we find it's very, very positive because we make sure that patient wishes, needs get written into the commissioning plans. There are some excellent examples of high quality services for people, but not throughout the country in general. So the opportunity of having a national commissioning board is that we raise the game and that everybody delivers to the highest quality nationally.
Well, I'm very pleased to see that there is quite a lot of mention and reference to mental health issues within the paper that we've read. It's nice to see that there's so much about patient and family. Well, it would be nice to see more reference to families' involvement, but a lot of that actually does spring from local voluntary sector initiatives, and I think there needs to be much more acknowledgement of this as we work through it. However, I do think it is a tremendous opportunity for us, and we should grasp it.
I already believe in the power of the service user to create change. I think that's already happening, so it is good to hear that that's being recognised by the people at the top level. It's how much support we get as user groups to continue that work, how much funding we get is so vital, so that we can commit to it, give our time for it, making sure that the user's voice is heard, making sure users can access information easily about their particular need. Hopefully, the voice of the user will become stronger within the NHS.
This is an opportunity for all of us to get it right. It's making sure that you engage with the right people, but making sure that you've got patients and the public at the heart of it, making sure that patients and the public understand what they have to do. It's offering the right support to the public, but also bringing in all the expertise from the third sector that we have and using that expertise where possible. Everybody wants to get it right. There's a huge cost to getting it right. It's time. I think the crucial part is involving patients and the public at every stage of the development, but genuinely involving them. Enough is enough with the rhetoric. We need the reality for patients and the public.
We're trying to build the commissioning board by listening to as many voices as we can. We're getting patient groups, patient organisations, patients directly themselves to feed back to us. What are the kinds of things that we should be doing? What are the priorities that the board should be making? And how should we work to make sure that all patients have a voice? Not just those that are obvious, but also those that are disadvantaged in some ways. The people we very seldom hear from, because the NHS is for all people, not just some.